PCOS, Polycystic Ovary Syndrome, affects 1 in 4 women. It can cause all kinds of problems with fertility and mental health. Fertility coach Crystal Leochko joins us ahead of a big conference that she's hosting on PCOS. Thanks for joining us.
Hi, Annette. Thank you for having me.
Yeah, we want to get the message out here because even though it affects so many women, very few women know that they have it because it's very tough to diagnose.
Yeah, it's kind of crazy. There's 3 hormones that they look at that are affected. So insulin resistance, androgen, and progesterone. So that's one of the problems that with diagnosing it because there's so many symptoms, but the doctors usually try to go by that, try to go by insulin to see your insulin resistance, if there's cysts on your ovaries, as well as your high androgen levels.
Okay, and sometimes you can have this but not have cysts, correct?
Right. Lots of times. And you can also have weight gain around your belly is very common. These girls work out. 80% of the girls I work with have it, and they work out like crazy. They watch their diets, and they just have no movement because their belly weight is so bad. Facial hair is really bad, acne around the jawline, depression, anxiety, insomnia, the list goes on. So it's really difficult for the women.
Right, and especially if you add to that it causes infertility, that can add even more problems with women that are trying to have a baby.
Absolutely. And you can get diagnosed as a lifelong disease. So you can get diagnosed at 13, at 12 when you start your cycle and live with it your whole life. So it's very frustrating trying to deal and cope with the symptoms because the doctors a lot of times don't pick up on what it is. So you may feel the anxiety and the weight gain, but you might not have the insulin resistance or the cysts on your ovaries or the high androgens or irregular cycles. So it doesn't go diagnosed. So it's so frustrating, and it usually comes to a head when people are trying to get pregnant, and then they figure it out, and then they're trying to manage and figure out what to do.
Right, because there is no cure for it.
There is no cure, but we have a lot of tools that we can use to manage the symptoms and make you more comfortable and even eliminate a lot of the symptoms. And I always say lifestyle is like the key. So I just recently launched a program called PCOS Pal, and we work on lifestyle, diet, nutrition is big, exercise and movement, mindset, and helping you with all the emotions that go with it. So it's a 90-day program, and it's working really well for the girls in it. And yeah, if anybody has any questions, I would love to share with them.
Okay, we'll put all that information up when we're finished here. But you're also raising money for PCOS awareness through T-shirts. And it also is, it helps, like if you're wearing the shirt, then people will ask, what is that? And it's just great to get the conversation started, right?
Absolutely, absolutely. So this is our PCOS awareness shirt, and we made a really good price. It's $65, shipping included, and it just gives us PCOS hope. And we're giving $5 to the PCOS Awareness Association, and they're providing resources. Like they provide laser hair removal for facial laser hair removal for the women, because that's when you're dealing with mental health, all that goes with it.
Yeah, all that goes with it, right. Okay,
yeah.
So we'll get the information up on screen now about the conference that's coming up, and we'll put the link in our website, chch.com, to all of your socials and to the website as well. Crystal, great to talk to you again. Thanks for the work that you're doing.
Okay, thank you.